Hi. So today we're talking about progesterone and the sex hormone that we hardly talk about. Okay, so progesterone is a female sex hormone, but it is in men too, and we don't talk about it enough in our men or in our women. So we've got to talk about progesterone today, and we're going to slowly talk about it because I want to emphasize its importance. Okay, in both women and men. So, what's progesterone? Progesterone is a sex hormone that is formed in the ovaries, in the testicles, in the adrenals, in the brain, in the glial cells. It's formed in a lot of tissues that are very important for both men and women. And what I need to stress is that progesterone actually is the precursor to testosterone and estrogen. Go figure. Did you hear me? It actually is the starting point from which testosterone and estrogen are made. So that is how crucial progesterone is. And when it's low, boy, we see a lot of horrible things that happen to us. And we don't realize that it's progesterone. We think it's testosterone, we think it's estrogen, we think it's something else, the thyroid. But no, it's progesterone. So please have your progesterone checked because you will be surprised. It is the culprit. Okay? Now for women, when it's low, it can cause all sorts of menstrual problems, right? Irregular cycles. Sometimes you can't even get pregnant, right? And then you've got pregnancy issues. Then you've got the menopause issues with the vaginal dryness, right? The hot flashes, the mood swings, the irritability. You can't sleep well when progesterone is low, right? The memory loss, the weight gain, the actual aging of the skin, and a lot of times when you have weight gain, you tend to bloat and you tend to just feel heavy and just miserable, especially when you have anxiety, and that anxiety makes everything worse. All right, so guess what? You can be turned off sexually and with your partner when you got all those feelings going on, right? Even in the young, I see this. I had a young 16-year-old. She had low progesterone, and all I did was give her progesterone, and boom, she came back. They had kicked her out of school. They had said, "Oh, we can't deal with her because she is completely out of control." And they tried all sorts of different synthetic things, but I must stress progesterone can be synthetic and it can be bioidentical, which means it's identical to the hormone we make in the body, the endogenous progesterone, which is what I want, the natural progesterone. Now, yes, the synthetic has its uses, but right now I'm talking about the natural progesterone, okay? So when she was given the natural progesterone as a cream, she came back and she could go back to school because I kicked her out, right? So again, progesterone is important for both men and women. And in guys, like I said, it is the precursor of testosterone. And when progesterone goes down, testosterone goes down too. And when progesterone and testosterone go down, guess what happens to guys? Your estrogen goes up through the roof. And we don't want you to have estrogen. I said that before. Go back to my previous talk on estrogen. No estrogen above, I don't want to pass 30. Okay? So when we are using progesterone, we can consider it to use in both the men and the women. So when it's low in guys, you can't make good sperm. Your sperm is not healthy, right? You have low testosterone, okay? You also have a decreased libido, just like in women, right? You have hair loss, just like in women, okay? You get big, you gain weight, just like in women, right? Your muscles get so weak, your bones get weak. You can get arthritis from this stuff if you don't have enough progesterone, right? Fatigue, you're also going to get impotence, and you're going to have actual just lack of motivation, depression. You're going to have all those psych issues when you don't have that hormone. Because remember, it is actually made from pregnenolone, right? Allopregnanolone. And the precursor of allopregnanolone is progesterone. It goes to allopregnanolone, and that goes to GABA and stimulates gamma, which is great for calming the brain. Great for calming the brain. It's a neurosteroid, okay? So it really helps the brain and actually has been used in studies in calming the brain in terms of brain injury, right? People that have had traumatic brain injuries have had progesterone given to them, and they actually responded well in some studies. Even smoking cessation. more benefits in the guys. It can help you stop smoking, smoking cessation. During COVID, they did some trials and some studies where they found that they gave some progesterone and it actually, in men, it actually helped men survive longer because they found that men were dying more than women during COVID. So there's studies out there saying that progesterone can protect the brain, neuroprotective, for both men and women, but especially for men because we have low levels of progesterone. We have a little bit more than you guys, okay? So it's important to know that if you don't check that hormone level, you're going to miss out on something. Because remember, it also can protect men from prostate cancer and women from uterine cancer and ovarian cancer and breast cancer. So we use it in women a lot, but the guys, we don't remember it. It even stops you making an enlarged prostate. And a lot of you guys have enlarged prostates where you have that urinary issue where you pee more frequently than you should, or you wake up at night and you urinate, go to the bathroom too many times. I don't want you going to the bathroom even once, guys. Not once. If you go to the bathroom one time, there's a problem. That's correct. I'm telling you, I do not want you going to the bathroom at night. You should be able to hold that urine, go to bed, have great sleep. And if you have low progesterone, you're going to have, horrible sleep. So you got to get some progesterone measurements checked. And there can be other causes, of course, but one of the causes is low progesterone. But I want you to go to sleep, wake up with a full bladder and empty in the morning once. If you're emptying it more than once, there is an issue. Please see your doctor, okay? See a doctor like me, see a primary care doctor, see someone that can actually correlate your progesterone, your prostate, and your other hormones and see what's going on with you in terms of, examining your prostate, okay? See if it's enlarged. So when my men can get progesterone, they are actually getting it for anxiety and they're getting it to help their prostate sometimes. And again, you don't want it too much. You want very low doses. Sometimes I give it twice a day. Sometimes I'll give it at night. Sometimes I'll give it as a cream. You can get it as a cream, injection, a vaginal suppository, a tablet, right? A capsule. So it all depends on what we're trying to treat. But generally, you've got to see a doctor that knows what they're doing and have them evaluate your progesterone and your testosterone and your estrogen and other hormones, of course. But in particular, this is a neglected hormone that I want you guys to ask your doctors, what's my progesterone level? And if it's 0, guys, we want a little bit higher than 0 because it can make you much more calmer and sleep much better at night, okay? So when we are in the world, again, the chemicals, the poisons, the toxins can all disrupt our hormones, including progesterone, just like I mentioned with estrogen. So I want you to know some foods that can increase your progesterone. I don't really go into this a lot with other hormones, but this one is very important because, again, you guys, men, just need a little bit. So let's talk about some foods that can improve your progesterone. Broccoli, beans, Brussels sprouts, cauliflower, kale, cabbage, walnuts, pumpkins. Okay, so those are some foods that you can eat, right, that will improve your progesterone. And some foods that will actually bring down your estrogen, okay? Again, broccoli, cabbage, shellfish, okay? And bananas. Bananas actually bring down your estrogen too. So when you bring down estrogen, you're actually giving us more or trying to improve your progesterone because once you get high estrogen, progesterone, and testosterone go down as a reflex. So we have to try and stop estrogen buildup. Remember, we get that in our environment from foods, etc. Like I talked about before, and I don't want high estrogen. Get that estrogen level measured also, and watch what you're eating because a lot of the foods. And again, I go to my estrogen talk. Just listen to it. It talks about some ways that you can get estrogen without you even realizing it. Okay. The advantage of taking these foods is that you'll improve the balance, and how much you do, you got to get measured to see how much you're going to improve the levels, okay? But you really want to make sure that progesterone is a good level, both in men and women. And again, it depends on the cycle in women, depends on if you're having a cycle or not. But otherwise, in men, you really need to get a check and see what you're doing, right? Because you're more steady than us. The most important aspect in terms of progesterone is really to help you stay calm and to help you sleep. And when the balance of progesterone is off, your sexual function is going to be off. Both men and women, you're going to both have decreased libidos, right? So not only the decreased libido is a problem, but the brain, again, the brain, the mood, the anxiety is such a major problem in the bedroom for men and women. So you want to not be anxious, you want to be calm and cool, so you do want to get that checked out and make sure that you are optimal with your progesterone, not only other hormones, okay? So again, I'm going to emphasize, progesterone is an understudied hormone. Even studies don't have a lot on them, so we need more studies on progesterone. And we're not focusing on it enough because we want to see how it connects to your sexual function. And remember, guys, it is where your testosterone comes from, okay? And women, it is where your calm and your balance to protect your organs, female organs, comes from too in terms of cancer risk, okay? And you really want to feel lubricated, and you want to feel less of the menopausal symptoms, especially if you have a risk of breast cancer, because that's a risk with what I said, the different hormones that you can get. You can get breast cancer, but progesterone will protect you from that. So remember, sometimes you can rub it on the breast and it can protect you. And again, this is all in the functional medicine world, not conventional medicine. So you got to be careful. Some studies need to be done to prove that presently. But please understand, guys, you need it for anxiety. We need it for anxiety. You need it for sexual function. We need it for sexual function. And if we don't have it, we will not have sexual function and will not have the calmness we need to get along in the bedroom, okay? All right, guys. See you later. See you tomorrow. Ciao. Have a good night. Bye.